Carry on, Annika. Thank you.
Thank you very much, Ulrika. And welcome to this session. We're going to do something a little bit different from the previous sessions. We're going to have a fishbowl. We're going to start with Stephen Kidd, I'm sorry. Sorry. That would have been something, wouldn't it?
Sorry.
Stephen Kidd from Development Pathways. You're working as a consultant. Stephen is going to start us off by a 15-minute introductory remarks on targeting versus universalism. Professor Barrientos will give some brief comments. After that, it's up to you. And we invite you to come up, a couple of people at a time, to sit here on the stage with Stephen and Armando to discuss and debate this issue. And Charles down here will help facilitate so it goes smoothly. So if you're interested in participating in the discussion, please come up and be around here in the front so we can quickly get you up on stage. So, Stephen, the floor is yours.
We're not the. It's going to come, is it? All right. Well, I'd first like to start and thank the Church of Sweden and Help Age International for inviting me to come and speak at this event. I want to start by saying I thought the last session was brilliant and fascinating. I really hope we don't disappoint in this session. Hopefully we'll just build on from that and perhaps get some of the participants engaging in the debate as we go through the fishbowl. What I would like to start, because in terms of a few clarifications on terminology, I don't like the term social protection. I think it's become very, very problematic in international circles. It means a lot of different things to a lot of different people. I prefer to use the term social security, so I'd use that. I don't like the term welfare either, which was used a lot yesterday. That's been used in the UK over the last 20, 30 years to turn social security from an entitlement into a handout in terms of the perception of the public. So as the right to social security is what's in the human rights conventions, that's what I'll be using. I'm also very uncomfortable with the term targeting. Targeting, as Amartya Sen wrote in 1995, is really about hitting a target. It's a very dehumanizing term. We're trying to hit people with a target. It's much better if we use less dehumanizing terms like selection or identification of people is a much better term, nothing to use. So I'll try to use that. When I have targeting, I'll be up in commas to forgive you, so you can forgive me. Now, I'd like to start by saying I used to be an avid advocate of selecting the poor for benefits. When I first joined and led the social protection team in DFID, I was a solid advocate of just identifying the poor, giving the benefits to the poor was going to be the best thing we possibly could. Then I went to Zambia, and Jimmy destroyed my talk by giving the anecdote about Zambia. I went to Zambia and saw this old woman running around with clutching herself, and when we followed her, as Jimmy was saying, asked her, what she was doing. It was payday on the Coloma program in Zambia, and she said, I've just picked up my money. I said, doing things for you, yeah, I can eat now, and I can do things, but I've lost all my friends, she said. Nobody wants to talk to me because I've lost all my friends, because I've got this cash and all my friends don't have it. And it was targeted at the very extreme poor, and of course all her friends were extremely poor, but they were excluded from the program, and her social capital had been destroyed. And then I began to think, perhaps there's something not right with this idea of just targeting the poor or selecting the poor, and I began to change, and hopefully this talk will sort of show some thoughts that have developed since that time. Now I'd like to start by saying that this is, I think, from we may have gathered from the previous session, really just an ideological debate. Right? When it comes down to it, targeting against universalism is an ideological debate. We have on the one side a neoliberal paradigm, which has become dominant in the last 20 or 30 years, and with the main rationale really for targeting, if people are honest, social security schemes at the poor is to reduce the costs, make them cheaper. That is the only real benefit. If we don't want to spend so much, then we'll select only the poor for our programs. We can call this Tea Party social security, the United States Tea Party, because it's all about a small state, limited taxation, limited redistribution. And that's the main rationale for those who want to just select the poor into programs. It comes at the price, as we'll see, of an inferior scheme that excludes the majority of poor people and poor older people in terms of pensions, and provides them with smaller benefits than with the universal program. The other approach, I think, which we can see, which was much more perhaps dominant up to the 1970s, up to in Europe. It's a much more inclusive paradigm of social security, which doesn't necessarily view actually higher spending as a bad thing, or higher taxes as a bad thing, or redistribution as a bad thing. Sees them as good because it enables you to do good social policy if you have more funds. Therefore, you can have more universal programs which are going to be much more effective in terms of reaching older people, poor older people, and poor people in general. Let's call this inclusive social security. So we've got the two sort of paradigms there. And the neoliberal paradigm, we've heard, certainly from Magdalena, is often associated with putting in place conditions on people where we punish them if they don't send their kids to school because we don't think that they're behaving. Or we put in place demeaning workfare programs to make them work, where despite the fact we've got increasing evidence that these workfare programs are harming child nutrition, harming women's nutrition, are actually in Ethiopia making children work, we're still promoting them enthusiastically in international development because they're very much part of this neoliberal paradigm. I think it's also probably a debate between Anglo-Saxons and Nordics, right? Very, very much this debate. This is a graph, if you can see, I think I can do with this. This scale up here shows the degree of targeting in OECD countries. The higher the number, the more you target at the poor. Along here, this scale at the bottom is the percentage reduction in child poverty in OECD countries, post-tax and transfer. Okay, so the higher the number, the greater that you're reducing poverty. What we see is that we have a group of countries up here that love poverty targeting, or selecting the poor, all Anglo-Saxon countries. And down here we have the little Nordic countries that are actually, with universal programs, way more effective in reducing poverty amongst children, but are not influencing the international debate on this in international development. All the influence on this and the paradigm is coming from the neoliberal Anglo-Saxon countries, and they're just replicating their philosophy in international development. Now, the point's being made, and it was being made by Jimmy, how can we target or select the poor when the majority of people are actually poor? There's a real misunderstanding of what poverty is and what poor people are. There's this idea that there is a group of the very poor, that they're static, and above that we have another group and another group, and that this is very, very static. Poverty is not like that. Incomes aren't like that. People's incomes move up and down, around any so-called poverty lines, which are always relatively arbitrary. You have people moving in and out all the time. It's a moving target if we're trying to actually do this targeting. We're trying to hit a moving target of people moving in and out. Now, to illustrate this, this is from a graph from Indonesia, where we've been doing work there on the old age pension and disability benefits. This is showing the cumulated percentage of households with elderly on the bottom, from the poorest to the richest in Indonesia, or the households, and this is their monthly per capita expenditure. What we see is there is very, very little difference in the incomes of, or the consumption of the poorest down here in the 10% up to here. It's not a great deal of difference. The chances of people falling into poverty at any point in time are great. Any shock, illness, etc., lose your job, you can fall into poverty. And what we find with these different poverty lines, the very bottom red one is the basic needs poverty line in Indonesia, which is really extreme, extreme poverty. Little shifts up in these red numbers to 20% up almost doubles the poverty rate in Indonesia. A 50% rise, we're getting up to well over 50%, or around 50% of the population are poor, and doubling it, we're up to about 67%. $2 a day is around here as well, which Jimmy's been telling us is, and I think Michael said yesterday, it's just far too little to live on. The majority of people in Indonesia are poor and in need of social protection. We're trying to select amongst this group of where they're actually moving up. Any time a household there may drop right down to there. Poverty rates just give you a moment in time, a snapshot. They don't actually show you the movements of people in and out of poverty. So in Pakistan, which has a poverty rate of 20%, the World Bank did some research and showed that 67% of the population spent some time in poverty over a period of 5 years. So why are we trying to target or select just the 20% of the population? Why are we not trying to protect this important group that are really vulnerable? And it's only at this point, really, in Indonesia, that you begin to get a big difference in terms of the consumption of people, where we can begin to identify much better those who are really much better off from this mass of people who are actually very, very poor. The other challenge is it's impossible to accurately identify poorer people or poor older people in developing countries. Nobody's come up with a methodology. It's absolutely impossible. There's lots of smokes and mirrors done in terms of how you present results around targeting, but it can't be done. The methodology that is most promoted now is the proxy means test methodology. We've written a paper about it to analyze some of the results. It's where you look at people's assets, trying to measure people's assets, because we can't measure their income or their consumption. That's far too difficult. So we're trying to measure their assets, like their houses, level of education, whether they've got animals or not, and we come up with some correlation with their income. Now, that a correlation is always very, very poor. The R squared, which I'm not really fully understanding because I'm not a statistician, is rarely above 0.5, which means we're only explaining 50% of income with that. The results then of the proxy means test are like this. When you target with the proxy means test to the poorest 10% in countries, and these are just the best you get from the theoretical targeting, this doesn't include the implementation errors, we're getting the 10% coverage, around 60 to 70% of the poorest 10% are excluded from the program. It goes down a bit when we get to 20%, where we find if we target 20% or select 20%, 50% or so are excluded from the program. The areas of exclusion are massive. Another way of looking at it is around the other side here on the scatter graph. On the far end, up here on the left, we have the proxy means test score, which is predicting your consumption, and we have the actual consumption from the household survey, and each dot is a household. Now, if there was perfect selection, then we would find a straight line, every dot on a straight line from there to there. What we find with the proxy means set is a relatively arbitrary selection of which households who are, for example, here, these ones here, are very, very poor, but are actually identified by the proxy means test as being quite well off. And so they're excluded from the program. And we find in most countries, therefore, that the majority are excluded. And what we find the proxy means test works as is it's a relatively it's a sort of like a lottery, and it's relatively good at rationing resources when you have a limited budget and rationing the resources to very, very, very few people, and it'll get most of them will be in the poorest 50%, but it will exclude the majority. And the reality, of course, is always much worse when we get down to do the implementation. This is just the Bangladesh pension, where they don't have a great selection mechanism for people, but this is where people can be found across the deciles, beneficiaries of the Bangladesh pension, which is reaching about 30% of old people. So everybody, all the beneficiaries should really be here in this static moment of poverty, but we find an awful lot here, and in fact, the vast majority of the poor in Bangladesh, poor older people, are being excluded from the Bangladesh old age pension. Now, we could improve the targeting as they're trying to do in Bangladesh by putting in place the proxy means test. No guarantee the results are going to be very much better. They tried this in Pakistan, where with the Benazir Income Support Program, where members of parliament were selecting people brought in the proxy means test, and actually the results in terms of accuracy were relatively similar with this new methodology. The key thing around the selection, or when we enter this bit of targeting, is actually the key thing is not the accuracy of the targeting, it's the coverage. And then we're coming back to ideology. It's about coverage. This is a scale where I've put a range of different programs, famous ones like Oportunidades we've heard about, Bolsa Familia, etc., along with other programs, the Mauritius Old Age Pension, Georgia's Old Age Pension. Now, this is your coverage along here of these programs. Okay? When we have 100%, it means it's a universal program. So the more it is towards this size, we're getting a much higher coverage, much more universal programs. The more we're getting to this side, these are much more programs that are just selecting or trying to select the poor. The number in the middle is the proportion of the poorest 20% of the population who are being excluded by these programs, okay? What we find in the universal programs, as you would expect, because this is just common sense, or the more universal, very few people from the poorest 20% are being excluded. Because if you're giving it to everybody, you're more likely to pick up all of the poor. With the poverty-targeted programs, or those trying to select the poor, we find very high levels of exclusion. So Mexico, this is information from UNDP in Brazil, 70% of the poorest 20% are being excluded by the Oportunidades program, according to the UNDP Inclusive Growth, Poverty and Growth Center, I think it's called now. Bolsa Família in Brazil, another famous program, 59% of the poorest 20%, more or less, are being excluded by Bolsa Família. They're not doing a great job of picking up the poor. The majority of poor people are missing out. And some programs, like Pakistan's Benazir Income Support Program, because the coverage is so low and the targeting is problematic, we'll find 85% of the poorest are missing out. And this is really comes back, it's an ideological question. If we want to actually reach the poor, which should be the objective of our social policy, is to reach and include the poor, we need to move towards much more inclusive approaches that are actually going to bring people in, but they're going to cost a lot more money, so we're going to have to tax a lot more. That's where the ideology is beginning to come in. Now, a key argument of what we may say are some of the advocates of selecting the poor is that actually if we've only got a fixed budget, the poor people will get higher benefits. So this is a quote from Stephen Devereux, where he's sort of saying, if we've got a given resource envelope, say $100, it'll have 5 times more impact on poverty if it's distributed to the poorest 20% than if it's thinly spread over the entire population. Now these are kind of, within the neoliberal paradigm, these are what Devereux would call the naive proponents of selecting the poor. Because it makes common sense. If you've got $100 and we give it to, and we have 100 people in the population, and we give it to everybody, they'll get $1 each. If we give it to 20 people, they're going to get $5 each. Makes sense. Great. Poverty targeting is a very good thing because they're going to get 5 times as much. Now that's the idea. However, the fallacy in this, as in a great World Bank paper by Lant Pritchard, if you haven't read it, is that the size of the budget is never fixed. This idea that there is a fixed budget, apart from donor programs, which have a fixed budget, in national budgets, there is no such thing as a fixed budget. Those budgets can be expanded, and the transfer level and the size of the budget is really dependent to a large part on the actual targeting or the selection process of the program. So to give an example, we're looking at old age pensions around the world on this. If that theory from Devereux was to hold, we would expect equal budgets, more or less, around universal and pensions, universal pensions and pensions that is just selecting the poor. What we find are that these are the budgets as a percentage of GDP up here. We find a lot of the old age pensions, and we can only do this comparison on old age pensions, which have over 70% coverage, have much higher budgets, often above 1% of GDP, even in Africa. We have the Bolivian example that we've heard about. Those that are beginning to select less than 70% of the population have much smaller budgets. It's what you, in a sense, you would expect that, but there's a lot of politics driving this. We even have examples of Nepal, one of the poorest countries in Asia, having a budget of about 0.5% of GDP, whereas Bangladesh and India, which are just trying to select the poor, are right down to very minimal levels of expenditure on their old age pensions. And there is a dialectical relationship, actually, between the targeting methodology and budgets. Because what you're doing with universal programs is you're building alliances between the poor and the middle and the rich. As Amartya Sen said in his 1995 paper, the poor don't have a voice. They're weak. Politicians aren't interested in them. If we just give programs to the poor, nobody is going to advocate on their behalf. If we bring the middle class and the middle deciles and the rich into the programs, then they will advocate for the program. Therefore, the budget will be higher and the poor are going to do better. Pro-poor policies, I think, as we heard yesterday, are poor policies because they're leaving the poor alone and nobody else in the country is interested in doing. They're not going to. The rich in the middle are not going to pay their taxes so that the program goes to the poor. This is the fallacy of poor relief in the 19th century in England, where in 1800, 2.5% of GDP was being spent on poor relief. As democracy strengthened, the middle class got the vote. That dropped dramatically by the middle and later 19th century, about 0.5% of GDP, because the middle class who were paying for these programs did not want to pay for programs that they did not benefit from. What the UK began to transition to was more universal programs like primary education and ultimately, after the Second World War, more universal social security programs. But we're already beginning to put in pensions by the late 19th, the early 20th century. So we don't just get higher budgets, to blow away the theory of Devereux. What we find are actually higher transfers. The poor don't just get higher budget spending than the transfer level itself is higher because the middle and the rich are arguing for higher transfers. So here's Here's again a similar thing on the percentage of GDP per capita for the size of transfer of old age pension programs around the world. What we find, those with over 70% coverage, and included here contributory schemes within the coverage levels, we find they have much higher budgets as percentage of GDP per capita. Those in orange, over 70% coverage. Those in blue are beginning to drop down. A program for the poor is given really poor benefits. Okay, there we can see the evidence in international development, but this is the theory that has been known for quite a long time. So the advantage with universal or more inclusive coverage is that the poor are included in the program because it's universal, and the benefits are going to be higher for them. That's the big advantage that we're getting. Jimmy brought this up again, and I think was going back to the reference I was giving. The problem with targeting the poor is we're actually, in many countries, destroying the social capital of the poor. These important relations that were there. This is what I found in Zambia. This woman had lost her main sort of protection mechanisms, which were her relations with her fellows, by her getting the benefit and other poor people not getting it. We're leading to social conflict. It's been seen all over the world. Nicaragua and Mexico, there's some great studies from 15 years ago in Mexico, where showing that Oportunidades was creating new divisions within communities between beneficiaries and non-beneficiaries, both of which look relatively similar. And often, actually, in some cases, you had the beneficiaries giving some of their transfers to the non-beneficiaries because the poor had been selected. But there were lots of divisions, social conflict that was beginning to happen between these two groups. We've seen with the Proxy means test, violence and riots in Lesotho, Indonesia, and Palestine as a result of the imposition of the Proxy means test on programs. There's this common cry from citizens: we are all poor when we go into communities. They say, we are all poor. Why are you trying to divide us? Yet everybody who says, let's listen to the poor and let's listen to their voices, nobody listens to them when they say, we don't want you to try and divide our community. We want to come together. And what you find in many places, and it happens a lot in Malawi and Indonesia, for example, that communities, when they get the benefits, subvert the selection process by trying to give these benefits to everybody. You know, then they get called corrupt. But what they're actually trying to do is to try and maintain social cohesion within the communities. Universal categorical schemes like old age pensions have been shown actually not to cause these divisions. They're very strongly supported within communities, even by young people who will go out there and support it because this is on a universal basis, and everybody's granny and granddad are getting these benefits, and that's helping the whole family. I'm just about to get there to finish. So what I like to say is that even our World Bank friends agree with us on the technical advantages of universal schemes. This is from a classic book on pensions in 1994 from the World Bank, where they say, administratively, a universal pension is the simplest structure with the lowest transaction cost for the public pillar, an important advantage in developing countries with limited institutional capacities, incomplete record-keeping systems. What they're actually trying to say there is, universal programs, it's very easy to identify people. If we're just trying to identify somebody on the age of over 65 and over, it's much easier than trying to identify them if they're age over 65 and over and poor. And it's much cheaper to do. We just need to gather much less information, so we spend a lot less. We actually save a lot on our administrative budget. Other point, it avoids the disincentive to work and save inherent in means-tested plans. We know that if you give a benefit to somebody because they get it because they're poor, we're going to encourage them to be poor because they're going to be too worried to get out of poverty by working, because that may disqualify them. This is one of the big problems in the UK that we have, which Sweden doesn't have the same degree, which is why Sweden and Norway, etc., are doing much better in tackling child poverty, is because the programs are given universally in these countries, and childcare is given on a more universal basis, as I understand, and therefore young women, particularly single women, are more able to get in the workforce. In the UK, we put in place massive marginal rates of taxation so that young single women, or young mothers, find it very, very difficult to get into the labour market because they have to give up too much. Now, that's one other disadvantage of it. And I think, as the World Bank then points out, the universal coverage helps ensure that the poverty reduction objectives are met and provides a basic income for all old people. The problem with the World Bank is they just didn't like the higher cost. But then we're getting back to the ideology question. There are other design options, I think Sweden's showing this, of how to exclude the very, very rich if we want to. This is similar to the graphs that we saw yesterday, where up here we have the pension income. The more you get going up is a higher pension income, and here we have from the poorest person to the richest person. If we put in place a universal coverage, we can actually do it in some countries. I think Chile's trying to do this, put in place a foundation tier, and then you taper the benefit as you get to the contributory scheme, so that we don't discourage people from saving in contributory pensions. And that way we can begin to exclude the very, very rich if ideologically a country is very, very uncomfortable with it. So I'll finish now, and I think my final point is I think this really is just an ideological debate. I think it's on the previous session. That's what it comes down to. There are no real advantages of targeting the poor, apart from the cheaper scheme, but it will be inferior, and it will exclude necessarily the vast majority of poor people.
Thank you. Armando?
Is that, no?
I think,
Is that better?
yeah.
Okay, right. I'm not sure whether I should thank the conference organizers for inviting me to do this. Basically, they asked me to come and provide a different perspective on the issue of targeting and universalism. Now, of course, Sweden has a very long tradition of adhering to the principle for universalism on its welfare provision. And of course, HelpAge International has argued, as Stephen eloquently put it, for universal pensions for people over the age of 65. So I'm kind of somehow going against the grain of the conference organizers and perhaps the conference. So I don't think I'm going to thank them for inviting me to do this. But nonetheless, it's really important. And in a sense, you see, my job, my day job is as a researcher at the university, and our job really is to challenge. And this is perhaps I'm earning my keep in doing this today. Now, going on to Stephen's presentation, let me start by saying that he made the job very easy for himself, because his problem that he's telling us a solution of is if you have unlimited sources of financing coming from taxation or from international aid, and you have the objective of establishing a pension scheme, then how would be the best way of allocating that fund to the people who are over a particular age? That's rather easy, because you see, if you look at the population below $1 a day in the world today, over 70% of them are children. That is, not all people who are old in developing countries are poor. Not all of the people who are poor are old. In fact, the majority of people in poverty out there in the world are not in that particular category. And I use a particular word because when he talks about universal, he really means categorical, right? If by universe we mean only people over the age of 67, it's a really old universe that we're discussing. Why someone who is, let's say that in a particular country the age of entitlement is 67 years of age. What about someone who is 66 and 364 days? What happens with someone who is 62? What happens with someone who is 45? What happens with someone who is 17? And in fact, the best way of getting as many people as possible living long lives in developing countries is not necessarily only through income security in old age, but it has to do with health, it has to do with education, it has to do with nutrition when they are children. So in a way, the problem in the way it's being presented is rather too easy compared to the issue that I have as my problem, which is to eradicate poverty globally. I mentioned the issue of the use of the word universality in that context. If we work from the Declaration of Human Rights and the human rights discussion that we had earlier, what the human rights provision says that everyone has a right to social protection, social security. Everyone has the right to a minimum living standard, regardless of their age, sex, religious affiliation, and so on and so forth, in the absence of discrimination. And of course, to say that only people who are 67 and over can get it, but no one else can, is really not very much in line with that perspective on universality. So I think there is an issue about the way in which the problem was presented. I think that if you look at the conditions that governments in developing countries have, it is also rather different to this issue of having unlimited resources to social protection. That is not the case. In most developing countries, and especially low-income countries, there are really hard choices that governments and politicians need to make to be able to allocate the scarce resources that they have. Uganda, for example, collects 13% of GDP in taxation, 13% of GDP in taxation. That is to cover all the activities of government. And of course, they receive budget support that adds to that, but really that is the basis from which they start. So there are really hard choices to make in terms of whether to invest in schools, whether to invest in hospitals, whether to invest in social protection, and whether to invest in other kind of government activities. And I think we need to place ourselves within that, that perspective. I don't think that that is an issue of ideology. It's a really hard reality that developing countries have. And I think we need to take that into consideration. Stephen also said that it is impossible to target. It's impossible to identify people who are in poverty. And he provided us with a few examples of that. I have a lot of sympathy with what Stephen said, in the sense that in many developing countries, particularly low-income countries in Africa, it's very difficult to distinguish between people at different points in the consumption or income distribution. There are, especially rural areas in sub-Saharan African countries, you know, they are all poor in a sense. The differences between the bottom decile and the next decile of consumption are very small. But I don't think that, that because we have the difficulty that we could then say actually targeting is impossible, because it's done, and it's done relatively okay in other contexts. If you look at countries in Latin America, for example, to begin with, they use several ways of targeting beneficiaries. They don't just rely on proxy means tests or on means tests. Usually have a combination of methods, and in a way the evidence that comes from people who have researched into this issue really argues that using one method is truly not going to help you very much, that you need to have a kind of several approaches that you need to put in place. Mexico Progresa, for example, today is called Oportunidades. They had 3 levels of selection. The first selection was the states in the country that had the greatest poverty, and they selected 7 states. Within those states, they identified the communities that had least resources and greatest poverty. So that's another one. It's a geographic kind of selection. Then within those communities, they did a census of all the households. They knocked on all the households and found out what were the conditions of that particular household. So you have a household level selection of beneficiaries. And then on top of that, when they had an identification of the people they wanted to participate in the program, then what they did was to ask the communities to check and confirm that that was okay. In fact, many communities said, no, you got it wrong here, but perhaps this particular household that you left out, usually households with just older people, were not really incorporated into it. So there are ways in which you could select beneficiaries effectively from a technical point of view, but also in ways that have approval and support from those communities, and that have approval and support from, more generally, taxpayers and other members of of the public. So I think that I'm not going to suggest to you that selecting beneficiaries is easy. I don't think I would ever say that eradicating poverty is going to be an easy job, right? It's never going to be easy. There are kind of real difficulties in terms of data, how you process it, the methodologies that you use, and getting political support around that particular way. But there are many examples of countries where that is done in a way that gets significant political support. The other point that Stephen made was about the famous middle class hostage situation. That is, to have social security, you have to include the middle classes. If they're not in it, they're going to be against it. They're going to undermine it. They're going to destroy it. There's never going to be support for the poor. I'm really not sure about that argument. I would really advise you to look at the Pritchard article that Stephen mentioned. It's a really hard economics article. I mean, I'm an economist. I sat there with pen and paper. It took me about a week to read it. And I really kind of recommend that if you're really interested in this issue, you read it. Because the assumptions that that particular article has in place, for example, that everyone votes in the country. Everyone has one vote. All votes count exactly the same. So people vote in terms of their pocket, what Americans call pocketbook. What benefits I'm going to get from this? And they vote in line with that. As we know, in kind of real economies like ours, that is not how voting is done. Children don't have the right to vote. Why is it that there are more pension schemes than child benefit provision in countries where children don't have the right to vote? We know that money tends to distort the way in which democratic processes take place too. So I think I would really like you to look into it. But if you come from Latin America, the idea that incorporating the classes is going to give you an extensive universal social security appears to be a myth. In Latin American countries, from the 1920s onwards, most countries in the region developed social insurance institutions. And trying to emulate the example of European countries, they of course started with usually the military. That is the first people you give pensions to. You don't want people with guns, disaffected going around the streets. Then you include civil servants. Then you include railway workers. And the idea behind the extension of social security in developed countries was that then you will go on extending this process and incorporating other groups until you get to the vulnerable groups. In Latin America, we never got there. We've had social insurance schemes since 1924 in many countries in the region. But the extension of social security stopped with formal sector workers. It never reached informal sector workers. The middle classes were never interested in including other people except formal sector workers. Only a few countries, Uruguay, Costa Rica, perhaps managed to extend it a bit further. And the reason why they did it wasn't because the middle classes benefited from it. It's because they had strong social contracts. And those social contracts allowed the social security institution to expand. We have a situation in Latin America today that the way in which social security is being extended is not by extending social insurance, but by extending social assistance. And this is why we're here today, because programs like Bolsa Familia or the two non-contributory pensions in Brazil, for example, have led to a situation where over 90% of people over the age of 65 have access to some form of pension, right? And most people who live below a quarter of the minimum wage have access to Bolsa Familia. It has been social assistance, not social insurance, that has managed to reach these groups and include them within social protection. So the view that you need to have the middle classes, because if you don't, they're not going to pay taxes, I'm afraid from Latin America doesn't look very good. I mean, how further we got to go in Latin America to wait until middle classes vote for social insurance for people in poverty or informal workers. It's taken 100 years to get to this point. Do we need another 100 years to wait until these people are included? So I don't really think that that particular approach is important. I think, though, that there is a point in there because what we need are really political alliances to support the expansion of social security. There are political alliances that are based on ideas, are based on values. We have two examples of very clear renewals of social contracts that lead to the extension of social protection. The case of South Africa after the fall of apartheid, which led to a new constitution in 1996, which introduced for the first time the principle that everyone should have the right to social protection. And we have the case of Brazil, which had the dictatorship until 1985, that led to a new constitution in 1988 that also established the principle of social protection. Those are two examples where the renewal of the social contract is what leads to this expansion of social protection. So from that is, to me, the crucial thing. It's really the politics, not the technologies of selecting beneficiaries. That is really what is going to give us a really, truly universal social protection in developing countries. Thank you.
Thank you very much. Thank you for those two perspectives. And now I invite Jimmy, come up. We're going to do fishbowl. Charles, do you want to start too, or? There are microphones up here. No. For this thing to work, you have to come up here. We're going to try this, otherwise we'll... Was there somebody else behind? Yeah, please come up. You have to talk in the microphone, Jimmy. Please come down. So the idea now is that the people who join will have a discussion and debate with Stephen and Armando. For a couple minutes, and then we'll switch. Great.
So,
Jimmy.
Yeah, I'm not sure whether Armando believes what he just said or he's just playing devil's advocate. No. I'm serious about this. This is not a joke. You have what do you call legal schools, law schools where you have a mute something and you allocated a topic and you then have to find arguments for it. So what I need to know is, does Armando actually believe what he just said now, or was he just playing devil's advocate?
Armando, what do you say?
I wouldn't waste my time in saying it if I didn't believe it, yes.
All right, okay, so you believe it. Well, actually, it is not true. It is not true. It is not true that you're dealing with unlimited resources to finance. I will talk about social policy, not social protection. So let me give the example in Western Nigeria where I grew up. And I said earlier on today, I'm here because a group of young men and women who took over in the late 50s insisted that every child shall have a right to education and your access to healthcare shall not depend on the size of your pocket. Armando, do you know how much the financing cost? It's £1 per person, adult male, in Western Nigeria. £1. It is not true that you need expensive money. This is part of the myth of the new army in the international aid, community. So let's take an example of the expansion. I have a paper here which I can distribute on this.
Jimmy, I think let's try to have a discussion. So,
yes.
Let Jimmy comment.
Let me just finish this because this is important. And the notion of allocation of scarce resources is in the imagination of the neoclassical economics. Scarcity is the extent to which you make it scarce. 3, when you say the objective, your objective is to eradicate poverty, I'm not sure what level that we're dealing with. There is the one that the World Bank goes around saying, which is MDG1, which is $1.25. I just said earlier on that, in fact, in Latin America, the social inclusion index used $4. Now, who wants to live on $1.25 today and define that as the eradication of poverty. So what exactly is this poverty? Because everybody now says, you know, poverty, we reduce poverty. What is the measure of poverty? We all agree that money metric measure is problematic. Finally, and that's the point here, is this. It is easy to make this argument this way because everybody seems to be restricted to a very narrow understanding of social protection. And Armando, you just said that you are concerned with social assistance.
Yeah.
Which is vulnerability exposed. If you're going to deal with structural poverty in the context in which I come from, it's education, education, education. That's what you do for the next generation and this and that. In other words, it's a more comprehensive issue. The point that I think Stephen was making, which is considerable evidence for this, is where you have 70% of your population being poor. What are you targeting? And what we've not been told, and I would like Armando to deal for every one of the projects in which you've been involved, with all due respect, please tell us the cost of targeting, the cost, the administrative cost. Who takes the money? Who are the people who actually take the money? And if you did not have that money, which is part of this scarce resources, how much people will it have covered if it didn't go to the new army of consultants that are, you know, roaming around the world today?
Armando, make a comment on that?
Well, in terms of the, I think the idea that there are unlimited resources out there in developing countries to do kind of everything we want, I think I'm not sure about that. Not much more that you can say about that. But it might be interesting for Jimmy to say, to tell us something about why is it that the social pension in South Africa, which reaches something like 80% of the population, hasn't been made universal. I mean, what are the reasons that people have in South Africa for preferring to have a social pension that has a means test attached to it, which admittedly is not implemented very strictly, but is nonetheless there? Why is it that they have taken this step? And I think my sense, I mean, you might be able to confirm it or reject it, but my sense is that people in South Africa feel that extending the social pension to whites is not necessarily a very important or priority issue in terms of social policy there. And this is why you still have the means test attached to it. And that is really the point that I was trying to make, that in every society there are reasons why people introduce programs in particular ways. We can look at those reasons, we can see what is the effect of them, whether they are sound or not sound. But
Yep, Stephen?
Can I come in?
Yep,
'Cause
sure. And then,
I mean,
then we'll pretty come in.
yeah, on the South Africa question, I mean, it actually proves, sorry, is this, I must have the same one that you had there.
something
Jimmy,
got
is it?
it done.
Yeah, it's on. Is that better?
Yeah.
Yeah. I mean, the South Africa actually proves the point that I was saying. In South Africa, 70% of the population are getting the tax-financed old age pension. That's the voting bloc of the ANC. The black population, they've included those in the middle. They've built an alliance between the middle and the poor, and now poor old people in South Africa are doing much better off. On the basis of that, they introduced a child support grant, which is now reaching 58% of children 0 to 18, and is growing to be universal, much higher coverage in certain age groups. And the white population excluded from affluence testing, not means testing, and most of them have pensions anyway. So there's no real need for it. So you have almost universal coverage of pensions in South Africa, and this proves the point. So I'll come back later to some of Armando's other points. But I think I don't know.
But that means you can do testing, affluence testing. You can do that. You can do testing that it restricts.
But it's very different. Excluding a few white people in South Africa and Asians, and a few others out of it, an affluence test, right, which is not done very well because you just basically got to turn up and say you're poor, and you get the pension. It's very, very easy. Philosophically, they go for very, very high coverage, very different to these programs where they're just going after 10%, et cetera, and trying to do it. That's a very, very, very different challenge.
I want to pretty give your
Yeah, thanks.
reflections.
I'm going to share something my own personal understanding and how I came to learn about targeting and universal. As a feminist, even before I realized, as feminists, we talk the language of targeting. What about women? Where are women? Give it to women. And in the policy terms, I realized it's targeting. However, working on the national campaign for right to food in India, my understanding changed. And I realized without universality, there's no targeting and it would not work. And therefore, even as feminists, it comes from, so it's also important to understand where this ideology, even in social movements and activism in civil society, comes from. It comes from identity politics, that we are so concerned about specific interest group that we look at interest of that particular group. It also infringes on the solidarity principle that you talked about, that we become in silos and we are talking only about those particular interest group, but we're not talking about larger thing. But now let's look at, when we talk about universality, what is it that we are talking about? It could be universal in concept, but in delivery we are talking about the principle of equality and non-discrimination are at the heart of universality. It's not just, it should go to everyone on paper, but it's the realization of the right has to be from equality and non-discrimination perspective. So universality is also not just in that you make it for everyone, but is in all aspects of the delivery on definition of social security that has to be universal. A lot of times selection criteria, a lot of times the administrative process discriminates people who need to get it. Now what's the argument that people, bureaucrats or policymakers in my country or everywhere else give? Of course, we heard the argument of resources, and the other argument we get, what Magdalena talked about, the deserving and the undeserving. Policymakers are so concerned that, God forbid, a non-deserving person should get the entitlement. And in that process, there are all these checks and balances put in place so that only the so-called deserving get the right. And in that process, millions are denied the right who actually need it. And so from a human rights perspective, when we talk about universality, and when people say, oh, we don't have resources, we can't give it to everyone. I said, as a human rights person, I'm telling you, I don't care whether you give it to everyone or not. You have to ensure that no one is left behind. That's the human rights principle, that how do you ensure, even if one person is left behind, that's a violation of human rights. And so in order to achieve that, if you have to give it to everyone, give it to everyone. If you can achieve that by targeting, then target. But the outcome has to be that it has to reach everyone. Now the challenge comes, okay, we talk about universality, but how are we going to do it at a national policy level? How are you going to operationalize universality of social security? And we grapple with this in, take for example, a country like India, where diversity is like, we have diversity in terms of various ethnic groups, various castes, various, and how do you make sure that no one is left behind and the right reaches everyone equally? And therefore it's important, even if we talk about universality, we are not talking about uniformity. The design has to be keeping in mind the lived realities and specific vulnerabilities of the groups and communities that we are trying to reach, and that's where targeting could be the approach, because it's universality in outcome but not in design. And so just one more thing, if I may add, what we realized, okay, it's good to say, but how are you actually going to design a policy? It's complicated. It's how do you come up with a national policy which will actually fulfill equality, non-discrimination, and be universal? And that's where I feel the substantive equality framework of CEDA is very useful, because women's rights groups globally have used substantive equality framework to address. It's not de jure equality we are talking about, it's de facto equality, which takes in mind the specific vulnerability and the challenges that people face in accessing the right.
Armando, you want to comment? Or Stephen.
He hasn't said much.
No, Stephen.
Yeah, I think the key thing, is not to have an immediate, you could never have an immediate solution, right? Effective social policy is going to take decades to evolve. The Swedish system, European systems, took decades to evolve, but, you know, on the basis of more inclusive policies, universal primary education by involving the middle class, the National Health Service in the UK. We have a few universal programs in the UK, free at the point of delivery. If that was given to the poor, we'd have a United States kind of health system. You can do it, but these are done over decades. The problem is that people are trying to just reach the poor now and resolve the problem now. It's never happened in human history. It never will happen. So we're just going to target the poor, who we can't find because it's a moving target. They're all over the place. And there's so many are poor. So we do it. And the problem is, once you start doing this on a neoliberal basis, and it's a neoliberal philosophy, then you will never build the constituency for actually increasing the budgets and affecting the taxation rates. So nobody's talking about unlimited resources. We're talking about there is no such thing as a fixed budget. We'll hear, I think, this afternoon about Uganda, where we designed a universal pension there. Actually can be funded there from a very small increase in just the existing tax increase. It's not particularly expensive. And I think, I'd just like to say to Armando, I think it was confusing sort of a discussion around children and old people, which I always find very, very confusing, with actually the target. I gave the same talk similar in Indonesia just 3 weeks ago. It was all about children, you know, and child benefits, and how it could be much more efficient in Indonesia, how with a very small amount of spending, you could actually effectively tackle child poverty in Indonesia with a universal benefit, rather than these silly little programs that they have like PKH in Indonesia, a conditional cash transfer that everybody's enthusiastic, reaches 1 million households in a country of 230 million people. And everybody thinks it's a big program. It's tiny. We did other research in Bangladesh. Bangladesh spending 2.1% of GDP on its social security or social assistance programs. That's a lot of money. The impact on poverty and the poverty gap, we did the analysis. It reduces the poverty gap by 2.5%. We simulated a child grant for 0 to 4s, only 0 to 4s, at a limited amount there. We could reduce the poverty gap, national poverty gap, by 12% at a quarter of the cost, just with the universal. I could give example after example of evidence, but the evidence isn't looked at. And one thing on Mexico, great, did it. The UNDP found 70% errors, and in urban areas in Mexico, if you have a car, you're more likely to be on opportunidades than if you don't have a car in the urban areas of Mexico. It's an interesting paper showing this result. So
let's hear from some other voices.
Can I just
hang
correct?
On, Jamie,
can I just correct one thing? Can I just correct one thing?
Sure.
Before this
quickly,
thing,
because we want to hear from some other
it
people.
It is not true that in South Africa the old age pension excludes people because they are white. It is not true. All right? If there's evidence that white people are excluded because they are white, I would like to see the evidence. You may have lower coverage because of and this is where the problem comes in. If you're already covering 70% of the what do you call it, old age people, what is the problem with the remaining 30% if those 30% are the one paying the tax? Just as a bench, you know, what do you call it, special someday. And what you're getting in South Africa is the kind of resentment that you were talking about. We hear stories about how teenagers are getting pregnant so that they can get social grant, even when the evidence shows that there's declining fertility and that people between the ages of 18 and 25 are less likely, who have babies, are less likely to claim than people between 25 and 35.
Thank you, Jimmy. Let's hear from you, Joachim.
Can I just add,
yeah, can we?
Because
I just want to make sure. There are a lot of people who want to.
Yes, but
So
none of the panelists have answered. So I would like to ask, how do you make sure no one is left behind? Is it universality or is it targeted?
Yes. So let's please switch. Joachim and. So if you just. Thank you.
This feels a bit like a prize giving. You come onto the stage.
Here, you can sit here.
You can
No,
start. What about this one?
no, oops, I'll
We're supposed to
please have a seat, Armando.
Sure.
Okay, I just want to make 8 quick points, but I think my first point speaks directly to the previous discussion, and that is as a result of the direct advocacy from civil society organizations in South Africa, the old age pension and the child support grant from 2015 are both going to be universal, as announced by National Treasury, because of this whole idea about the exclusion. So I think that's a really important lesson for the other countries to take on board. I think, and some of these issues might have been raised, but I speak quickly, so you forgive me. One of the reasons why it's important to have a universal system is that we're going for rights-based systems, and rights have to be universally appreciated. In South Africa, due to the means testing that's currently seen in the social assistance grants, there was this bizarre situation where the police decided that people who were cheating the means test had to be seen as organized criminals, and so seen in the same way as the drug runners, the sort of the pimps and that, and so there was a whole special investigation into the organized criminals of those people who were so poor that they tried somehow to subvert the means test for a very little amount. That whole idea of criminalizing the poor is crucial, I think, in terms of the rights-based analysis that we're working from. I do, however, think that we need to be very clear about the terms that we use. There's a distinction, for instance, between targeting and categorization. The ILO presentation on a sort of minimum social floor, I think, is crucial because we need to distinguish between income security, which should be universal, so that everybody should have income security. But on the other hand, if you're having a disability grant, there's a clear categorization there. That's not going to be universal for anybody. I think the question about targeting is something which we need to be very, very clear about in terms of how we approach things from a very strategic perspective. And Armando, I mean, I heard from, I don't know if you know Senator Suplicy in Brazil, who was very in favor of a basic income grant, and he came and did some work with us in South Africa. And he said that former President Lula was very in favor of a universal basic income grant, but then, in terms of the Bolsa Familia design, decided that the middle classes would advocate against the adoption of a universal income, and so did the categorization. I think that the challenge of trying to gain back the ground once you've advocated to your government that they need to go for targeting because you think that that's more palatable is critical. So in South Africa, we do have very good schemes that are used for children and old age pensioners, but between the ages of 19 and 59, you have no income support. And I think we lost that battle by trying to be too clever. And finally, of course, the question of universal is that you increase the taxation. And so you reinforce the role of the state as a distributor, especially in countries such as where you have such high income inequality as ours, where the market doesn't do that. Thank you.
Joachim?
I've been increasingly sort of frustrated, not by this particular discussion, but by the fact that we are, I think, confusing concepts in the discussion about universalism and targeting. And also that we sort of seem to be, in many ways, ethnocentric in our discussion of a different policy alternative. So, of course, this whole conference is sort of an expression of the Nordic or Swedish ethnocentric approach to how you do social protection in the best way. And Armando, you also gave an expression of some kind of Latin American ethnocentric perspective on the failure of sort of social insurance approaches to include poor, vulnerable segments of the population. So I think that we need to be contextualizing our discussions much more clearly into the existing institutional frameworks that are already in place in Latin America, in South Africa, but then recognizing that there are a number of countries where there is virtually nothing at all. And I think that my take on this is based on the sort of what I see as a fundamental sort of normative starting point, and this is the rules approach, that we should judge societies on the basis of how they treat those who are worst off. But that is not sort of automatically translated into sort of designing institutions that are directly exclusive to those who are sort of worst off. but rather in sort of looking at the West European experience and seeing that countries that have managed to somehow integrate the middle class in systems that also include poor people seem to be much more successful in terms of really eradicating poverty. But maybe also that this sort of poverty perspective is delimiting, that we need to go beyond that. So we shouldn't understand Rawls' idea about it's only about poverty, but something more, and also about developing beyond not only 1 or 2 and 4, but also other amounts of dollars. So here, I think the real challenge is to how do we design strategies in the poorest countries that can take us on a development path that is not ending up in the Latin American situation, not ending up in the Southern European situation where there is no, I mean, in Greece or Italy, there's no no nationwide system for social assistance, for example. So I think this is more about how we design the combination of policies, both on the cash side, and how we combine policies on the cash side with things that can sort of add to progress in society. And I think that maybe I will take side with Armando to see sort of the basic income approach as deeply problematic, because that is sort of creating an illusion that we can create resources without working. And I think if we recognize that we need to have different kinds of conditions attached also to the kinds of benefits that we see are as universal, then I think we can move beyond this sort of deadlock between universalism and targeting, and sort of understand that we can achieve a lot more if we combine both universal and targeted programs. But without an idea of universalism, I think that we will end up on a problematic development path for the poorest countries.
I mean, can I sort of step in here? No, you.
Hello. Yeah. Stephen and I had a very animated debate last night before the dinner, so we missed all the train thing because we were discussing conditionalities or not conditionalities. Basically, what I want to say is that what this discussion is missing a lot is the political economy of social protection, or the political realities in countries. I think everybody here were struck of the two small plays, the one yesterday and today, and struck by the opinions expressed by Swedes in the age of 1905 when this was debated. And I'm quite sure these kind of opinions are very much expressed right now in developing countries when these questions are discussed on the political scene in those countries. It is in that political reality that reforms has to be secured. So I've been participating in some missions discussing design of some of those programs that you have discussed. And the Minister of Finance is saying, I don't want any handouts. And of course, one can discuss and one can argue with him, but what does he mean with handouts? But that's also an expression of attitudes that exist in those societies. So I think we have to be fairly humble, and we have to have a middle or long-term perspective. I think what has been achieved in Latin America with a lot of conditional programs is a first step, and now we are seeing social pensions getting into in several countries, in Peru and others that has been mentioned. So we have to have a perspective where we include political realities, what is possible and achievable in short and long term, and see this as a long-term engagement.
Stephen, do you want to comment?
Yeah, on a couple of points. I mean, I think it is, I mean, I fully agree. I think it's a long-term debate. No country can put in place every program that's universal. It's the underlying philosophy upon which you start your journey. Are you going to be on a human rights basis in which everybody will be included, or you're going to start off by excluding a whole load of people, particularly the poor, by just targeting the very poor. And then you'll never achieve the political consensus in the next 20 or 30 years to allow for the much greater inclusion and much greater budget. So I think that's critically important. I think the ethnocentric idea, I mean, I think there was one point I was going to make, I think, about ethnocentrism. What Armando was saying is, you know, the idea of good practice. You know, in African communities, you know, all these development agencies have no problem in, as Armando was saying, to help their targeting, putting a list of the very poor up on the community, get the whole community go and read that list and find out who's been declared as poor, as if black Africans have no dignity, as if Asians have no dignity. Of course they feel stigmatized. They're telling us they feel stigmatized, and people are putting their names up to help their targeting, and these people are feeling ashamed because they've been identified as the poorest and the most vulnerable in their community. They don't want that. They want an entitlement. That's what they prefer. But we do these things because we have ethnocentric ideas, which we would never do in our own countries. Put a list up on the wall so everybody can come and see who's poor. But that's seen as just a normal thing, a normal attitude, because we haven't thought it through, the fact that people have dignity, whether they're black or brown or whatever. They have the same levels of dignity. But we treat people, poor people in some of these countries, in a very different and undignified way, which does not respect their rights at all. I think that's, I think the Latin America debate, you know, I think it's, the problem with Latin America is it's only just getting, democracy's only just beginning to take place in Latin America. After the dictatorships fell in the 1980s, etc., we had a long time where the right wing was still being voted in by very poor people. It was still a manipulation. Now we're getting a sort of much more what you would expect, left-wing governments coming into Latin America. And what we're finding, these conditional programs that were put in place very much by right-wing parties, often, as a means of social control to keep the poor quiet, are now being taken over by more universal programs gradually across Latin America. There's an increasing universalization around often old age pensions, but Argentina now has a child benefit for 85% of children 0 to 18. You know, so we see in Brazil actually, you know, the moves to now 63% of children, and a lot of advocacy around making the child benefit part of Bolsa Familia and the other 2 child benefits that they have, which are just as big as Bolsa Familia, come together in a universal program, which would actually have much bigger impact than the existing Bolsa Familia. So they're on a path, but we've got to remember, it's taken decades in developed countries. It's going to take decades here, but let's not get off on the wrong path with a neoliberal approach that is alienating the taxpayers who are not going to support these programs.
Joachim.
You can, in the history of this country, find very similar practices, for example, when it comes to means-tested school meals. So you line up the kids in 2 lines, and I think there are many countries that have the same experience. I think that, and you can find, I mean, a huge number of examples of bad targeting. This doesn't say that we can have, couldn't have good targeting in the sense of including the I mean, broad majority, as your graph suggests. There are a number of countries which have embarked on a different sort of journey by including a majority, not fixing the target on a very small group. And I think this is where I think the possibility of making progress in terms of reaching a consensus of you know, how do you do the first step towards a more comprehensive and universal approach. And I don't think that we can ever escape that the rights-based approach is tied to a number of conditionalities.
Armando, you want a final comment?
I want to make a few comments. The one from Stephen just now. By the way, let me tell you that with Stephen we've done this before. So if we're fairly sharp, it's because we've been there. The blood on the carpet is just tomato ketchup. Don't worry about that. But it's outrageous remark that right-wing neoliberal governments have introduced conditional cash transfers in Latin America, and I think I cannot let that pass. The Bolsa Familia began as a Bolsa Escola, a program that provided transfers for families in poverty and helped children go to school. That was initiated by the Workers' Party in several municipalities in Brazil in 1995. And it was the Workers' Party and another center-left party that then led to the expansion of these to other municipalities, and eventually became a kind of a national program in 2001. And when Lula, perhaps another neoliberal, was elected, he said, okay, we're going to have Bolsa Familia. I think that really does not reflect the reality of how these programs have evolved in Latin America. But I wanted to take a couple of other points that are really important. I think the point about the political economy of these programs is really crucial. And I'm going to tie this up with the comment that Joachim made about roles, because it's really a lot to do with roles. According to John Rawls, who's an American philosopher, the problem with our societies, capitalist societies, is that they generate considerable inequality and poverty and deprivation. So he felt that a society to be able to be sustainable and stable requires some mechanism by which people who are disadvantaged as a consequence of the way the economy operated still felt that they had a part to play within that society. So he felt that if you're low income, if you don't have a lot of rights, if you're not recognized by the state as a citizen, eventually you would say, well, this is not for me and I'm off. And in a sense, that's the history of Latin America going back to the 1970s, revolutionary movements, coup d'etats, and so on and so forth. And what he felt was needed was some social minimum that ensured that people never felt so strained from society and perhaps they're disadvantaged, that they felt that they belong and they were part of it. And if you look at a lot of the expansion of social assistance programs in Latin America, that is precisely the role that they play. It's not just a matter of transferring cash. It's also a matter of including groups that previously had been excluded, mainly from social insurance institutions, into a social protection system. It's a kind of citizenship point. Let me make a short point on that too, because again, perhaps we have different ethnographic sensibilities. A lot of studies that have looked at social assistance transfers in developing countries find very little stigma attached to it. The National Rural Employment Guarantee Scheme, for example, has, to be able to access your employment guarantee, you have to apply for a work card. You can actually go on the internet today and check everyone who's accessed a work card. That is not considered to be stigmatizing. It's just a part of the transparency which the program works. And in fact, if we are going to have a rights-based social assistance, it has to be transparent. It has to be accountable. So I don't think that of course, in the case that Stephen mentioned, it could be done in a way that is stigmatizing, but publicity is never stigmatizing. The light of day is the best disinfectant. So I don't think that this is necessarily a problem. There is a sense in European countries that receiving social assistance is stigmatizing. There is a very good reason why people have that perception, because until about 1940s, if you access social assistance, you were taken off the electoral register. You have to have means to be able to have the right to vote. That has never been the way in which the franchise worked in developing countries. There was never a wealth assets attachment to the franchise. So I think that perhaps may be one reason why stigma is not, don't find a lot of it in Latin America. Thank you. Sorry.
Thank you very much. And thank you to Stephen and to Armando and to everybody who's been up here discussing this very interesting and multifaceted issue. Unfortunately, we have to break this discussion now. I encourage you to continue it over lunch. If we don't go to the restaurant now, the kitchen will be angry and you won't get any food. So thank you all very much.